So how does this have anything to do with children who have trouble learning to talk or learning to read? When I first started doing my research in the early 70s, I was interested in trying to understand what the problems at the linguistic level were for these children. What are the problems that they were having learning the grammar of a language, learning how it all worked together, how to express their thoughts and their feelings and whatever. But I was trained as an experimental psychologist, and I knew that the first thing you had to do was to rule out more basic problems. So the obvious things that I would have to rule out is that the children could hear, that they didn't have a hearing problem, that they weren't mentally retarded, that they didn't have any problem with the oral musculature. All the basic building blocks of language I had to demonstrate first were going to be in place before I could begin to understand what was specifically linguistically the problem for these children. It also occurred to me that there was more to processing the complex acoustic structure of language, ongoing language, than just hearing at the peripheral level. I was very interested in what happened to the sound when it left the ear and moved through the nervous system into the brain. And what are all the different pieces that must be in place to ultimately get to the point that you would be able to organize these acoustic features, put them into words into sentences, whatever. So I developed a series of processing tasks for little children who were about 6 to 9 years old, just to make sure that they could hear fully. They could hear, not only detect that sounds occurred, but also could organize sounds that were occurring that were more complex, that were occurring that were brief and occurring rapidly in succession, made up of combinations of frequencies and amplitudes and all the things that would be necessary to ultimately process and represent a speech sound. And pretty much to my surprise, because I really thought these were just control tasks to rule out that there was any problem here so we could get to the language part of the problem, very much to my surprise, it turned out that on the whole, children who were struggling to learn to talk, who did not have a hearing impairment, who were not mentally retarded, didn't seem to have anything else wrong with them. Their normal, healthy, happy children seemed to be developing great. They were quite different in the way in which they organized basic non-linguistic signals, complex auditory signals in general. The building blocks in which one would assume you had to put together to come to extract the phonemes of a language really weren't in place for these children. And in particular, they seem to be having difficulty tracking and integrating brief, rapidly successive tones of different frequencies. So they were having difficulty tracking frequency changes that were occurring rapidly in succession. And that's rather critical for language, since speech is a series of rapidly successive acoustic changes that have to be tracked and coded and represented. So did a lot more studies with children with language problems and found that it seems to be a hallmark of many, not all, but many children who are struggling with both oral and written language, that they are slow processors, that their brain just needs more time between events to integrate them and track them over time. And this became known as the temporal processing deficit. Temporal was only a part of the problem. It's really a temporal spectral processing problem. That means a difficulty tracking acoustic frequency changes occurring over time. And that problem, interestingly, turns out to be something you can pick up quite early in life in children. We've just recently completed a study in which we looked at normally developing infants who were 4 to 6 months of age to begin with. Brought a bunch of little healthy babies into the lab, and we wanted to know whether or not we could determine how much time they needed between little tones of different frequencies, just to indicate whether they heard the same two signals or two different signals. So they would come in to the lab, and we would train them to look to a little toy that was on their right side. If they heard beep, beep, a low signal followed by a high signal, but to turn their head and look to a toy on that side of the room if they heard beep, beep, the same two sounds. So look over here if you hear two different ones, and over here if you hear two same. And of course, they don't know the concept of same or different. These are just normally developing 6-month-old infants, but they can be fairly easily trained to look to this side for beep, beep, and over here for beep, beep. Okay. And they do that because when they look in the right direction, this little toy claps its hands and they're very excited because they've controlled the world, and that's what they're here to do, learn how to do things. It's all about learning. So when they've learned to do that, they get very happy and they'll look in the right direction, and you can actually determine very, very well what that individual baby's threshold is for how fast can these sounds now come together for them to continue to perform at a high level of accuracy. So you start off with nice long signals with nice long intervals. Beep, beep, something like that. And then as the baby continues to correctly respond, you very subtly begin to just decrease that time, that silent gap between the end of the first signal and the beginning of the second signal. So it might eventually become beep, beep, and then later even beep, beep. Okay. And what we want to know is how fast do those two come before you've lost it. And there's a point for every one of us when the signals come so fast that you can no longer hear the difference between them, and that's called your sensory threshold. So we wanted to know what that threshold was for each of our little babies. And then we had another group of babies, and these were babies that were born into families that already had one or more family members who had either a current or a history of oral or written language problems. We've done it both ways. So we wanted to know if you have a family history of a language learning problem, is your ability to track these brief sensory events, the acoustic events, different than a baby who did not? Well, we followed a lot of babies over time. And then what we do is once we've established their thresholds when they're about 6 months old, we can then track these babies and really evaluate these individual children's language development trajectory. So we can see them again when they're 12 months old, and when they're 18, and when they're 24 months old, and 36 months old, and you can just carry on following them up. And this work was done by my colleague, primarily April Benesich at Rutgers University. And what we found was that if we just know the individual sensory integration threshold, auditory integration threshold for an individual infant, regardless of whether or not they do or don't have a family history of a language learning problem, that's the best predictor of language development. And we've only gone up to about 3 years old now, but all the way up to 3 years old. So knowing something as simple as how much time you need to organize the information that you hear is highly predictive of your language development. Now, those children who were able to have very low thresholds, that means they could process very quickly this sensory information, beep, beep, something really fast. Those children turned out to develop language more quickly than the children who seemed otherwise to do the task perfectly normally. They could learn it just fine, but they needed just a little bit more time. Beep, beep, something like that. And then there were other kids who needed a lot more time, like hundreds of milliseconds. They needed something like beep, beep, okay? They still were doing the task beautifully, but they just couldn't hear those differences when they went any more quickly than that. Those children turned out to be, frankly, language impaired. But it turned out there was a whole continuum from those children who learned language very quickly to those children who appeared, at least at the age of 3 months old, to be at risk for real language problems. And of course, now we're going to continue following these babies up and see whether or not that also predicts whether or not they're going to have difficulty learning to read.